Welcome to our compliance tip regarding appropriate use of Modifier Q5 and reciprocal billing arrangements. The information in this video is not intended as consulting or legal advice, and guidelines quotes in this presentation are from Medicare guidelines. These guidelines apply to the insurance carriers following Medicare rules. Always check with your major payers to ensure your coding and billing is compliant. Modifier Q5 is a HCPCS modifier primarily used to bill Medicare when a substitute physician has seen the patient. This differs from Modifier Q6. Q6 is used when the substitute physician is under a fee-for-time compensation arrangement, previously called locum tenens. Today's presentation addresses Q5 for physicians. When reporting Modifier Q5, remember this checklist. Another physician which is not part of the physician's group agrees to see and treat the patient because the regular physician is not available. This can be because the regular physician is ill or on vacation, and it is only permitted when the duration of coverage is under 60 days. On an occasional reciprocal basis, a patient's regular physician will arrange for a substitute physician to provide services, including emergency visits or related services. Under a reciprocal billing arrangement, the patient's regular physician may submit a claim to Medicare Part B using his or her own National Provider Identification or NPI number, and if assignment is accepted, receive payment. However, the conditions listed on this slide must be satisfied. Modifier Q5 is appended to the procedure in field 24K on the 1500 claim form. For a medical group to submit claims for a substitute physician, that substitute physician should not be a member of the group. The requirements for submission of claims under the reciprocal billing arrangements are the same for both assigned and non-assigned claims. These requirements do not apply to the substitute arrangements among physicians in the same medical group when claims are submitted in the name of the group. In this case, the group physician who performs the service must be identified. Another condition which is required to be met by Medicare is that, until further notice, the regular physician who is billing for the reciprocal visit must keep a record of each service provided by the substitute physician on file. Included in this record should be the substitute physician's National Provider Identification or NPI number. The NPI is a unique identification number for covered healthcare providers. Covered healthcare providers and all health plans and healthcare clearinghouses must use the NPIs in the administrative and financial transactions adopted under HIPAA. If post-operative services are furnished by the substitute physician, the services cannot be billed with Modifier Q5 since the regular physician is paid a global fee. They need not be identified on the claim as substitution services. A physician may have reciprocal arrangements with more than one physician, and note CMS states these arrangements are not required to be in writing. If services are provided by a substitute physician over a continuous period of time longer than 60 days, the regular physician must bill the first 60 days with Modifier Q5, and the substitute physician bills the remainder of services in his or her name. The regular physician may not bill and receive payment for services over the 60-day period, and a new period of covered visit services can begin after the regular physician has returned to work. The term covered visit service includes not only a service ordinarily defined as a covered physician visit, but also any other covered items and services furnished by the substitute physician or by others as Incident to services. Items and services furnished by the staff of the substitute physician covered as Incident to. His services, if billed by him, are still covered if billed by the regular physician. Items and services furnished by the staff of the regular physician covered as Incident to. His services, if furnished under his supervision, are still covered if furnished under the supervision of the substitute physician. Now, a continuous period of covered visit services begins on the first day that the substitute physician provides covered visit services to Medicare Part B patients of the regular physician. The period ends with the last day on which the substitute physician provides these services before the regular physician returns back to work. This period continues without interruption on days when no covered visit services are provided to patients on behalf of the regular physician or when furnished by some other substitute physician on behalf of the regular physician. A new period of covered visit services can begin after the regular physician has returned to work. Let's try an example. In this example, the regular physician goes on vacation, say June 20th, 2019, and doesn't return to work until September 4th, 2019. A substitute physician provides services to Medicare patients of the regular physician on July 2nd, 2019, and at various times thereafter, including August 30th and September 2nd. The continuous period of covered visit services begins on July 2nd and runs through September 2nd, a period of 63 days. Since the September 2nd services are furnished after the expiration of 60 days of the period, the regular physician is not entitled to bill and receive direct payment for them. The regular physician may, however, bill and receive payment for the services that the substitute physician provides on his behalf in the period July 2nd through August 30th, 2019. Download applicable resources from your major payers. For Medicare, this information is found in the Manual 100-4, Chapter 1, Section 30.2.10, and also download the Modifier Q5 fact sheet published by CMS. Both links can be found in the video's description below. As always, I hope you enjoyed this modifier compliance tip and that this information helps to improve the accuracy of your claims. Learn more about documentation and coding requirements. Consider obtaining your Certified Medical Documentation Professional, or CMDP credential. Contact us today. We're here to help.